Hi everybody and happy Tuesday. I've got some updates for you. First thing that you should know is that we have instituted installing tents in our parking lots outside our clinics. We've done that and we'll be posting these signs for our patients to know that they need to not enter the clinics if they have a fever, a cough, runny nose, etc. And instead what we will be doing is triaging them in the parking lot. Second thing I wanted to mention to you is to discuss for a few moments our masking protocol and the risks that we have if you're masked or unmasked. So first thing, if you are sick and have a fever, you need to contact your supervisor and you need to stay at home. If you come in contact with a patient who has a fever and an unconfirmed COVID-19 or coronavirus suspect, and they are masked, you are low risk for exposure. And if the patient is masked, you are also low risk for exposure for the disease. If you are unmasked and the patient is unmasked, then you have moderate risk of contracting it. Therefore, what we ask that you do is to wear a mask and self-monitor for 5 days. It's different if this patient has a fever and a later confirmed COVID-19 or coronavirus infection, and they were masked, or you were masked, there's a moderate risk still. Therefore, we would ask that you wear a mask and self-monitor for 5 days. If the patient was unmasked and you were unmasked, then you are a much higher risk of contracting it. Therefore, we would ask that you stay home for at least 5 days and self-monitor. Of course, if you develop worse symptoms, the best thing you can do is to report to the emergency room for assessment. If you develop any problems with shortness of breath and difficulty breathing, then you definitely need to go to the emergency room. Otherwise, you're okay to report for work as long as you don't have a fever. If you have a cough and a runny nose, I would ask that you wear a mask at all times. The risk of transmission to your fellow Terry Riley team members is still low, but we want to minimize that risk as much as possible, so please wear a mask and self-monitor. We ask at all times that you work with your supervisors, and the clinicians can be a resource for you as well, especially myself, and I'm happy to entertain any emails that you need answers to. Anyways, remember, wash your hands, cover your mouth if you cough. If you have a high fever, stay home. Otherwise, take care and be safe.